Nosebleeds in children. Should I be worried? Hi, this is Dr. Gowthami Muktineni, Consultant Pediatrician and Neonatologist at Rainbow Children's Hospital, Financial District, Hyderabad. Nosebleeds are quite common and cause a lot of worry and anxiety to the parents. It can vary from mild to severe. Severe can be sometimes irritating, messy, and scary, like a scene out of the horror movie. Why do nosebleeds occur? The kids have nasal passages which are so delicate with lot of tiny blood vessels. Dry air, frequent nose picking, and allergies, cold, sneezing too hard, and sometimes the sudden changes in the temperature like hot air, cold weather can irritate these nasal mucosa and cause the bleeding. Here is how to stop the nosebleed in the kids. Try not to blow out the nose when it is bleeding. Always make the child sit upright, lean forward, and pinch the nose over the soft area of the nasal bridge for at least 10 minutes. Meanwhile, allow the child to breathe over the mouth and also try to distract the child by speaking to the child and reassuring the child. Please make sure that not to press over the bony part and pinch over the soft area. Don't tilt the head back because this bleed can enter the throat and can irritate the child. Apply a cold compression over the nasal bridge to slow down the bleeding. And during this process, don't allow the child to have a hot shower because this can dilate the blood vessels and make the bleeding more worse. Here is when to contact your doctor. When the bleeding is persisting for more than 20 minutes despite following the right steps, or if the child is bleeding too much, and if the child is feeling dizzy, or if the child is having weakness, or if the child is having bleeding from the other sides like bleeding gums or other bruising, because these indicate a clotting disorder, or if the child is having any nosebleed post-traumatic head injury, please seek the medical attention immediately. How to prevent the nosebleeds in the kids? Nosebleeds can be prevented by using a humidifier in the room air and also staying hydrated, using saline nasal sprays so it helps to keep the nasal lining moist, and also try to trim your child's nails so less nasal nose picking leads to less nasal bleeds, and also give the positive reinforcement to your child whenever the child refrains from the nose bleeding.